We are back with another episode of the Gaslit Truth Podcast.
Yeah.
I'm Dr. Teralyn here with my other wonderful host, Therapist Jenn.
Hey everyone, what
everyone.
up? We are coming down in 3, 2, 1 and then giggling. So
Yes.
what's happening?
We're laughing on our way in,
That's
which is
true.
fine because sometimes this shit is laughable. So
It so is. Oh my God. It so is.
So, all right.
Okay.
Well, today we have a big topic, right? I mean, I
Mhm.
think this is big. I think this is big and somewhat controversial, maybe.
I think it is. I think the
It's one of these things I think that shouldn't be, but
No, well, the controversy comes from what people don't know because once again, it's another thing that goes against the good old Western practices of that medical model, good old
it's true.
BS. So
It's
yeah, people
true.
don't
I
and
like
so
that
that's
though.
fine.
The controversy comes from things people don't know. We'll add another one in the Gaslit Truth Podcast way. The controversy comes from things that people are not curious about.
Right.
Ah,
There you
there
go.
we go. See,
That's
we're
good.
bringing it all home today. It's good. Tis good.
Wrap it around.
Wrapping around. All right. So we are going to talk about inflammation as it relates to your mental health.
Mhm.
And weirdly, it's controversial. But again, shouldn't be. I'm going to keep saying that. I don't know. I'm going to repeat myself over and over again.
You
Um,
can. That's fine.
yeah.
That's fine.
But okay, so when Jen and I start these podcasts, what we do is we send each other a bunch of shit, right? Like, look at this article and look at this one and check this one out. And what do you think about that? And so the first one, well, I've done some work like research and things. Okay, I gotta say, when I use the term research, I mean looking shit up. I don't do original research.
You're not talking original research?
No, I'm not
Are you
talking original
sure?
research. We
Oh,
use the
okay.
term research so loosely, meaning we look shit up. Okay.
We look shit up and we
And read
have
it.
an eye for what research may be helpful for a lens for this show and what research may not be, because you also are talking to two whistleblowing shrinks here and listening to us that are not just going to WebMD and just verbally gurgitating everything from WebMD to you either, because we also know how to read articles as well,
I mean, it's
how to
still
look for the
hard. Yeah,
holes.
I mean, that's still difficult.
You gotta look
I
for the holes.
probably yeah, you do.
Yep.
But this one did start with a Healthline article, that I sent you. So some things start with an article like that, and then they turn into research. So that's where we're gonna be in today's space. And
Correct.
so I sent Jen a Healthline article called "How Do You Know If Your Depression is Caused by Inflammation?" And so then I started thinking like, all right, so there's more to other mental health disorders, not just depression. I think depression is the one that we talk about most with inflammation.
It is. I
Yeah,
would
which
say
is weird.
that's common in the vernacular even when you're talking
Yeah.
about it. Like, it's
Or
usually
mood
the root.
disorder, like
Mood.
that
Yep,
bucket.
mood.
Yeah.
Yep, the mood
Mood.
bucket. Mhm.
The mood bucket.
So you're
So
saying it's not just that?
I don't it's not. It's
What?
not. And so, but think about this. So let's just say depression is an inflammatory response, right?
Okay. Yeah.
How is an SSRI or an SNRI going to tackle inflammation?
Mm.
Again, root cause, right? We got to get to the root
Yes.
cause here. And so
Yes.
if we are just looking at reducing symptomology or the hope to reduce symptomology, sure, take an SSRI. That'll reduce the symptoms. Maybe for some people, it increases the symptoms, by the way. This is what we've been told it should do.
Mhm. Right.
But if we look a little deeper, we might see that there's inflammation, which is why when I work with brain health clients, do you know what marker I ask them to get checked at the doctor? C-reactive protein, or even vitamin D, like all these
Yeah.
things, and your B vitamins are very important in inflammation and detoxification of systems. So
Yeah.
I ask them, like, go get this stuff checked. It's
Yeah.
important. It matters. And I don't know that I've had a single person come back without a higher inflammatory marker yet.
So for people that are listening to this podcast or watching us that don't have some of that just base knowledge on what you're talking about, Terry, can you give just a really quick Reader's Digest of why, as a brain health expert, that's the things that you ask for at the beginning? Like, what's that dual relationship that you're trying to
Well, I'm
identify?
trying to see if there's anything else going on, number 1. And when you look at inflammation, you can't tell exactly what's happening, but it could mean there's an infection going on. There's something in your body that is inflammatory happening. It could be an autoimmune
Mhm.
issue. It could be, you're healing from something, right? There's so many things
Right.
that could be indicative of. It could also be indicative of a high sugar diet, which Jen and I have decided to do a whole podcast episode on that. So that'll be coming soon on
On
sugar.
sugar. Oh,
Um,
yeah. That'll
right.
be fun.
But again, the relationship for me is a little bit I'm gonna say less deep because if you can see it, then it becomes reality. So if you get a
Mm,
lab done and you can see the results of the lab,
mhm.
suddenly you're like, oh, that thing is true in me. That thing is happening in me. So, right, Jen's
Yep.
raising her hand.
Right here.
If you're
This
watching
girl.
us on YouTube, she's raising her hand right here. Yeah, I've raised my hand.
Whoa, did that happen
Yeah,
for
I mean,
me?
I've raised my hand
Yeah.
multiple times, and if you don't have the information, you don't know, and I think in mental health particularly, people run wild without information about themselves. Like,
Mhm.
"Oh, it's just depression."
Right.
But why? But why?
Yeah, you don't get curious. You don't get curious about it when you don't. And it is. There's something about getting those
Yeah.
results, and when you look at your vitamin D level and go, "Oh my gosh, it's a 17." What does that mean? I've heard these things before, right? Or you get your you get your cortisol levels
Mhm.
back or anything that you're measuring and it's like, "Oh my goodness, that can't
Plus,
be
there's
good."
there's
Yeah,
more I wanna use the word buy-in because I can't think of a better terminology. There's more buy-in
sure.
when you know. Like, if you go to the doctor and they tell you your cholesterol is high, you've got high cholesterol, whatever, high cholesterol
Yeah.
markers. Your buy-in to
Mhm.
either to do something about it, however you choose, is going to be much higher than if you're like, "Well, you
Yeah.
might have high cholesterol because you know, you're overweight or something." I do not have high cholesterol despite being overweight, which is interesting. My husband does despite not being overweight. But anyway, like
Not being
exactly,
overweight,
right? So
right?
this
Mhm.
all this
Yep.
stuff is happening, and but unless you have the numbers in front of you, you don't know how to fix it. Even high cholesterol, like
Right.
what's your path of fixing it, right? You get to choose a path. Well, most people want to choose diet for that. Which is interesting to
Yeah.
me because you think about high cholesterol, even type 2 diabetes or high blood pressure. Yeah,
Yep.
when
Yep.
someone goes in and their
Yep.
first lab comes back abnormal for those, I don't think that most people are like, "Give me the meds." I think most people are like, what
Right.
can I do?
What can I get
Yeah, what
curious
can I
about? Yeah.
do? But we
Yes.
don't do that with mental health.
Mhm.
It's like, "Give me the meds." And that's it. There's nothing else.
I just wanna bring something up too, because I'm assuming this is gonna get interweaved in this discussion today because we're talking about mood and inflammation, right? Um, you just said something too, those markers, because I have so many clients going through this
Mhm.
right now that will also get curious because they will come to me and say, "Well, I'm within the range,"
The
right? Like,
range.
the range. That gets me, like,
Every time.
going when I every single time because when we again, that's what this whole discussion is about. That
The
range
range.
is just that range came from
Yep.
somewhere. That range came from
Mhm.
studies that allowed, right, for us to look at a population of
Mhm.
people that are there. My bottom line, because I will go on too long with this, is that range is not
No.
individual. So you can be in that range for all these
Mhm.
markers and still feel like
100%.
shit.
And I resonate with that with my thyroid, right? So for a
Yes.
long time, and I'm pretty clear, like I'm in a battle like constantly with the thyroid. And for a long time, I just listened to the doctor as to what within range meant for me, right? This number,
Mhm.
like this is the number the doctor
Yep,
wants you at. The number that I feel the
yep.
best at is nowhere near the number that my original doctor was like, "You should be here." You know? If I were
Mhm.
at the number that they wanted me to be at, I would be in bed 8 hours a day, sluggish and tired. The number
Well, that's not gonna work for us
No,
here.
that does not work for life.
That
That
doesn't
doesn't work for
that
life.
doesn't work for me,
Right,
thank
so which
you.
is why it's so, like,
I'm not doing this.
when you go to the doctor and they tell you, like, "You're within range," like, I'm just gonna speak for thyroid. I mean, the range is, like, up to, like,
Yeah.
4. I'm just gonna talk about TSH in general. The range is up to
Yep.
4. Last time I was a 4, um, I was I was terrible, like, I was literally napping 2.5 hours a day, okay? But I had never been that range before, so it suddenly came on. I don't know, I still
Mhm.
don't understand why. I'm gonna guess hormonal shifts, that's what I'm gonna guess, menopausal shifts, whatever. Anyway,
Sure.
but that was still within range, by the way. But it didn't work
So
for me.
exactly,
That
you
range did not work
can
for
be in
me.
that range. Yes, you can be in that range. So maybe that's another take home. I know, we're talking a little bit about, inflammation, which we're gonna tie this into inflammation is
Yeah,
right, because there's a dual relationship with inflammation, and mood
autoimmune
and vice versa, and
conditions,
we're
like
that's what I was just gonna say. There's this dual relationship, but I want people to get curious about this
mhm,
range because even this last week, I've had a couple people come through my practice and bring that number up. But I'm in that
I'm in
range, and I'll
range.
say, "Yeah, you are." And they're like, "I might be on the low end of it, but, I'm in that range." And I'm like, "Let's just get curious about what that range
To
means
you.
because you're not
Yeah,
feeling good."
right.
Correct, right. So ranges and numbers are not they are objective, they are a blanket, they come from
Mhm.
somewhere. There's something that, whatever governing body's putting this together, right? Whether it's the FDA, whether there's
Right.
right? Like whatever it is that has put this together, the etiology of the range is not for you and it discounts how you
Exactly.
feel.
Well, I hear this
It's just
particularly with
all over the
vitamin
place.
D, like because but I wanna go into the vitamin D discussion just a tad because it is not one of
Yeah.
the typical blood draws that you get. Most people that we deal with have to ask specifically to get their vitamin D levels drawn, which is so fucking weird to me in today's world. But anyway, and then they'll come back and be like, I'll always ask, "What was your vitamin D?" "It was good." And I'm like, "What does good mean?" Or "It was
Yeah,
fine."
it's good.
"It was fine. Doctor said it was fine." The range starts at 30 and goes up to like 100. Okay,
Yeah, it's like
that's a
890.
wide
Yeah.
range.
Mhm.
For someone who's struggling with mental health conditions, if you are in the low, like, come on, why don't
Mhm.
we just boost that up a little bit and see if it helps, you know? Or
Yes.
it was a 30 or a 29 and a half. It was a 29 and a half, so my doctor said it
Mm.
was close enough. And I'm like, "What
Mhm. Yeah. Yeah, I hear that, and then the
the"
next thing that I hear is the discussions that they then tell me they have with their provider about supplementing, okay? So I'm like, "Okay, yeah, let's hear it. Yeah, tell me what they're saying," right? And so there's really never too much discussion about
Mm-mm.
food, okay? That doesn't exist. I don't hear too much discussion about direct sunlight. However, once in a great while, right, I will hear that. But usually what comes out is two ways, right? It's here's a supplement, idea for a supplement, but the IUs that people
Are low.
are suggested to take are very low.
Unless they're
Now,
completely in the
unless it's
toilet. Wait,
contraindicated.
unless they're completely in the toilet,
Correct.
and then it'll
And then
be
well,
like a
yeah.
2-week course of super high vitamin D, and then you're done. And so there's no
Yes.
carry through or follow through. But we digress a little bit
Yes.
off topic, sort of, because inflammation is related to all of this, which is
Yes,
related to your
it
nutrients
is.
and all those things. But
Yes.
I wanted to
Yes.
bring up in particular this article from Healthline because it relates
Mhm.
to the podcast that we had about being treatment resistant, having treatment resistant depression. Because it says, how do you know if your depression is caused by inflammation? And it says you
Yep.
have other inflammatory conditions like autoimmune disorders, chronic infections, or I forgot to list this one. I'm sorry, inflammatory bowel disease. You don't have to be in a disease state to have inflammation. You can just have digestion issues, right? Like anything like
Mhm.
that. So I want to make that a little more broad. Your depression had a sudden onset, especially in response to an infection or injury. I'm going to add or a negative life event. Your depression, this is where it gets funny to me. Your depression doesn't respond to antidepressants. Okay. We're going to circle back to that one. You have physical symptoms, fatigue, joint pain, fever. You have high stress
Mhm.
levels. Chronic stress can trigger inflammation. Yes, it can. You have a family history
100%.
of both depression and inflammatory conditions, which I'm going to guess that family history is probably more related to autoimmune disorders and things like that. You
Yep.
have elevated markers of I can't even say inflammation like CRP, C-reactive protein, or cytokines in specialized blood test. That's key. At least get your CRP checked, your C-reactive protein.
Yep.
But I want to circle back
Mhm.
to your depression doesn't respond to antidepressants. Now, in the article we talked about, do you have treatment-resistant depression? Never did it suggest that your depression might be inflammation in that article. Not
Nope.
once.
Nope.
It was treatment
No.
resistant, then we're gonna go straight to ECT, electroshock therapy,
Yeah.
and that was it.
Yep.
Like, it was never like,
Yep.
there might be an underlying
Yep. It was
thing, right?
ECT, TMS, yeah, all those other things, some forms of psychotherapy, right? Like, there was some of that in there. Nothing there was nothing in
Mhm.
there about
Right.
inflammation or looking at some of these, like, more medical root cause pieces that could be occurring, right? Like, depression can come from so many different places. It's almost stupid that we're saying I
I
feel like
mean,
I can't even believe that we're saying this out
yes.
loud and that we are referencing articles, information that is out there for people.
None of the
There are
articles
so
that Jen and I pull up, well, Healthline is available to
yeah,
anyone, but even the research articles, we don't pay, they're not behind paywalls. I mean, there's
no,
more
there's no paywalls
research
here. Nope.
behind paywalls and journal articles, but this stuff, if you type in what you're looking for and then just hit the word research or go straight to
Yeah.
Google Scholar, you're gonna find stuff. Now, alternatively, I probably could find things that says there's no relationship between inflammation and these things.
So I was just
Right.
gonna say, if you're looking for what you're
You're
looking
gonna
for,
find it.
you're the AI within our web is going to generate
Mhm.
what it is that you're looking for as well, which is gonna confirm, right? However you type that in, you can make it like and we get it we get into some heated discussions on
Oh,
TikTok with
yeah.
people about this and like this idea that you've got to kind of know what you're looking for too, but you got
Yep.
to understand the biases that happen even when trying to search for something.
Yes.
So that's a fair thing to talk about as well because if you want to confirm a belief
You
you have
can
or don't
easily,
have, you could. That's
easily.
easy.
But,
Yep.
so then I was
Yeah.
getting really curious because I I was listening to a podcast and they were talking about inflammation and which is I've known about, but it was just kind of reaffirming, right, to hear it again by another MD talking about it. Um, and then he said
Mhm.
something that I'm like, I know this. So why haven't I talked about it? It was, do you know that your thoughts alone can create inflammation? And I was like,
Yeah.
yes, I do, and why am I not talking about it in terms like that? Like, and so I got real thoughtful about this because I'm like, okay, so we talk a lot about depression and inflammation being disease states, but not
Mhm.
anxiety, and I'm like, all right, so anxiety to me is
Ah.
more thoughts, right? The thoughts that trigger your fight or flight and all of those things causing this reactive inflammatory response.
Right.
What the fuck? Why are we not talking about this?
Where did that wait? Are you just mind blown? Did you just
I
blow
just
people's
blew my own
minds?
mind.
Did you just
I
blow
blew
your
I
own
blew my
mind
own
as a
mind.
clinician
I
of,
did because
20
then I thought
years?
about post-traumatic stress disorder.
Ah, okay. Let's
Okay,
go there.
so 'cause I
Let's
I
go
was
there.
like,
Yep.
okay, so something terrible happens to you, right? So there
Yes.
could be a physical response to that, right? Like you could be injured, right? It could be a medical
Mhm.
thing, so there's an infection, like, medical trauma or whatever. There could be lots of trauma,
Sure.
but what is PTSD mostly? What do you think it is mostly? Anyways, this is what I wanna talk about, and you can completely 100% disagree. Something terrible happens to somebody, and then what happens to that person that causes the PTSD? I don't know. I don't know. Do you have any thoughts? Like, something terrible happens, you get into a car accident. You have terrible
Mhm.
response, like your body, whatever,
Yes.
but then what happens to your
Yes.
mind? What happens to your mind?
Yeah. So my simplest answer, and when I talk about PTSD with my clients, because it's something that I don't have a lived experience with, not in the term of a clinical sense of PTSD. Okay. When I say this to my clients, and what I guess a lot of them have been affirming for the last, 15 years, is when you go through a trauma, you relive that trauma
Yeah.
repeatedly. Okay. Repeatedly. Um, and I can resonate with that and understanding that idea, because whether you're actively thinking about the trauma, okay, whether you're triggered by something in your environment, which you don't even know what the hell sometimes
Mhm.
triggers you in the first place, right? Because that's a lot of what the therapy is us figuring out what that is so you can manage that. Because what does it do? It takes over your
Yes.
brain. And it takes over your headspace. And when it takes over your headspace, we know that the neck bone's connected to the hip bone, and this is all one
Yeah.
machine, right? And so it starts to engage you both ways. Sometimes it's the brain that engages these physiological
Mhm.
reactions, and sometimes we have these physiological reactions, and then it takes us back to that memory. It's this vicious cycle. So really all it truly is reliving something in your brain
So,
that
can
impacts
I
your
boil
body
I
all day,
wanna
constantly.
boil this down, and this is not I'm just trying to make sense of it in the most simplest terms for me, okay?
Yeah.
I wanna boil this
Yeah.
down to, then it is your if you're reliving it, it is your thoughts, because those are thoughts, those are
Yes.
memories, thoughts are memories, all these things. So
Yes.
you are reliving these negative thoughts and images over and over and
Yes.
over again, which then goes back to your thoughts create inflammation. And there's this research study that I have. They looked at 65 published studies. So they're looking at other studies. Yes, and
Meta-analysis.
so
Yep.
they're looking at the
Yep.
long-term effects of PTSD as well as traumatic effects on inflammatory function. Um, they said post-traumatic stress disorder is related to the immune response, including an increase in inflammatory factors and a reduction in, I thought this was cool or interesting, anti-inflammatory factors. So
A
so we
reduction.
are increasing inflammation and reducing the ability to fight inflammation at the same time.
Uh,
Yeah. So
yeah.
additionally, it's been demonstrated that traumatic stress disorder and immune disease share a common genetic basis at the genetic expression level, which is interesting because I mean, we have a lot of genes for
Yeah,
inflammatory
there's yeah.
responses and things like that.
Mhm.
So
Yes.
that's to me, this was a really fascinating article because of the inflammatory nature. And again, that inflammatory nature, if something, terrible physically happened to you, right? Like a car accident or something like that. Like
Yes.
of course, your body is going to kick off this inflammatory response to heal,
Mhm.
right? And so that's going
Yes.
to put you at risk just that from what I'm hearing
Mhm.
here, what I'm reading here.
Yes.
But it makes me wonder about some of the witnessed PTSD, right? So you are a bystander, like you witness a horrific car accident or you witness something
Yeah.
terrible happening to somebody. It's not really
Yeah.
happening to you, but it is because you're a
Correct.
witness and you still
Yeah.
get PTSD from that, but nothing physical created this immune, I'm sorry, created this inflammatory response, right? Except for the
Right.
witnessing of and the interpretation of that
Yes.
stress response.
Well, in the idea of okay, and so when you're saying this, I'm thinking too about, I'm actually putting myself in a circumstance that happened,
Mhm.
okay? I would never say I have, like, PTSD, but you also know how I feel about
Well,
labels,
I think it's safe to
you know?
say that many of us have gone through traumatic events.
Multiple
Right.
traumatic
Yeah.
events, right? And I'm thinking about, so the altered reality, the altered perception of reality that occurs when you experience, okay, traumatic events,
Yeah, keep
okay?
going.
And so here I'm going back again in my mind to, I had when my father-in-law, and I can share this, when my father-in-law, maybe people could resonate with this, maybe with an example too, right? When my father-in-law passed away, just before he had passed away, there was multiple seizures that he was
Oh, yeah, the
having.
witnessing
Okay.
of that.
Multiple
Did
seizures. Yeah. And so I was there for that. Okay. Um, I've seen seizures before. I worked in a prison, right?
Mhm.
We had lots of inmates that would have seizures, and everyone would come to the rescue and try to help. Okay. Seizures never bothered me. My father-in-law has seizures. I witnessed this. I watched this happen. Okay. What's associated with that is also a loss because he
Yeah.
ended up passing away.
Grief.
So there's all these
Yeah.
pieces, right? Yeah, there's some grief tied to it, right? We fast forward like a year later, and two events happen at work in the prison. One, I see another inmate having a
Oh boy.
seizure.
Yeah.
Okay. And I stood there and I
Mhm.
froze, which is not a normal reaction I've ever had before. And I went into this almost like, unaltered
Yeah.
reality. And there I'm standing, but I'm not in front of this inmate, I'm in front of my father-in-law. Okay, and for a brief moment, I was not there, right? And so this actually happened a second time too when we had to watch a training video
So
for a
weird.
training
Yeah.
day on, like, CPR, and, we had to do all the all the medical, videos that you have to
Mhm.
watch, and you do the testing on and everything,
Yeah.
blah, 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 right? And there was one where someone was having seizures. How do you react to a seizure? And I remember sitting in that training room and I froze. And for about 2 minutes, I wasn't there. I remember coming back to and looking at somebody and going, "How long has this video been?" They're like, "Well, it just finished a couple minutes ago." I'm
Uh,
like, "I
yeah.
haven't been here." Yeah. And so I think about that idea of not only there's what you're saying, these genetic markers that may be turned on or off that can create some of this
Mhm.
for us, right? Then we have events that happen to us that immediately trigger a stress
Mhm.
response that we make a connection with the body. Shoot the inflammation shoots
Mhm.
up, right? But we are personally have a connection to it, whether it happened to us or we witnessed it. Then we're triggered throughout our lives, throughout our
Mhm.
days, right? And that same physiological thing starts happening. My reality is altered. I literally saw myself sitting there in the hospital, but I'm not. I'm standing in a
Right.
prison. And so this is all happening in my
Yes.
brain. And I also didn't do a lot with it either. Like, I knew it happened afterwards, but I wasn't sitting here thinking like, "Holy man, so not only does this event cause this for me, maybe there's genetic markers, but then I'm not doing anything with it
Right, you're just
either."
letting it
And so it
percolate,
continues.
or the idea that
But
you're
that's in
never
my
gonna
head though.
witness something so specific, like, you witnessed this person
Right.
that you love have a seizure and pass away, like, that's a very specific thing, but it doesn't take
Yeah.
the exact same thing to happen for it to be re-triggered
No.
and reignited within you, right? It's just something
So, and
similar. Mhm.
that's where the thoughts come in
Yes.
because our brains make connections to what we know and what we
Right.
recall. So in the moment, I go straight back to that event even though I'm
Yeah.
not there. I'm standing in a cell hall. There's an inmate having a seizure in front of me. None of that is connected, but we go back to what we
Right.
know and what we remember, which goes in. And I know we're getting a little bit into some of the brain piece with this, but that's when you say thoughts and
Mhm.
reliving, it really gets me curious about this idea then how many times my body went into that mode. I am triggering inflammation
Mhm.
responses, let alone maybe have some genetic markers turned on for me that could be influential as well from one event.
What
And that was my
Yeah.
thoughts. That's
I
really truly, and I know we're simplifying this, like, but and I don't want to minimize
No, that was
anybody
my
with
whole point. If
PTSD
you're
and
listening to this, this is not to minimize. This is to hopefully, like,
no,
get you thinking in a different direction. Like,
yes.
if some of this is an inflammatory response because of my thoughts, I'm like, then I don't
Is
wanna
there
use the word
solution?
easier. Yeah,
I know,
what's
but
the
is there another
solution, right?
solution?
And I feel like so we also live in this world today where, oh gosh, these 2 words paired together just make me shiver.
Okay, I'm
Toxic
ready.
positivity. Yeah. Toxic
Oh,
positivity, right? Like, you can't be positive about certain things, and I'm like, "Okay, but if you're only negative," right? And the most negative people that say things like, "Well, I'm a realist." Like, I've heard this, "Well, I'm a realist." And I'm like, "Well, you're causing a whole shit ton of inflammation when you are a realist, just so you know." If for toxic. You got to go to go to YouTube, toxic positivity. Yeah, she just wrote it and put it on a sign.
It's
But
like
it's
Brit. I'm addicted to you. Don't you know that you're
toxic.
toxic? Your positivity is so toxic. Look at us. We're on the
Exactly.
airplane. We're just
We're
in the
doing this.
airplane.
Yeah,
You guys gotta look
gotta
this up.
watch it
Like,
on
there's just a
YouTube.
lot of
Yeah.
chest action happening right here from these two women that have like
No
nothing,
chest.
nothing
Exactly.
against Brittany. Okay.
Exactly. And no
Yes.
chest. But
Yeah, but
anywho,
I know. I
yes.
know.
But and this feels okay. I'm going to say this out loud. This feels like blamey, right? Like if I say, well, change your thoughts, change your life, change your thoughts, reduce your inflammation. It feels like blaming the person for not having the right thoughts,
Oh, I
like
see.
for,
Sure.
yes.
Yeah.
And I don't
Yeah.
want that to be the case. What I want to be the case is this idea that you have more control over your mental health through your thoughts than you ever imagined,
Mhm.
ever, because of the role of your thoughts on the inflammatory markers that are likely the rationale
Right.
for your mental health problem. You know, there's
Yeah, but
other things,
but
there's other
that's
inflammatory things too, but
yeah.
like just at a basic level, like,
Yes.
I think, wow, therapists out there, if you're listening, like, your job now is so profound. Did you know that thoughts can change inflammation? You know, to me, that's exciting
Yeah.
as a therapist to be
That
like,
is very exciting.
wow, like
Yeah.
that's an even bigger deal, especially when you know that inflammation is tied to
Mhm.
PTSD, anxiety, depression, mood disorders, schizophrenia,
You know,
bipolar disorder.
I I think you hit on something too. So you and I are both trained in a few different types of trauma interventions. Okay. One of them being EMDR. We are EMDR therapists, right? And
Mhm,
EMDR is one of the more like gold standards for individuals that really struggle with managing symptoms
mhm.
throughout life that come as a result of traumas that you have endured in some way, shape, or form. The whole intervention in and of itself is based on the premise of the way in which your thoughts are stored in your brain. Okay,
Right.
now,
And
okay, so
how
as
you
you're
view
right,
circumstances and the
right.
internalization, the negative core belief that you have internalized based on that circumstance. What? My brain
So
is
now I'm just
blown.
geeking out for just a second thinking about this idea that I have never looked up to see if there is some research out there that
Oh my god,
brings
Jen, we need to do some research.
inflammation into this with EMDR.
I think we just did a research project.
Damn it. Seriously, now I'm getting all excited, right? Because all the research for EMDR, okay, there's lots of different markers that go into how they knew this intervention was
They do
effective.
more brain scans, don't
It's
they now?
all
Like,
yes, yes. And so
what
now
if
they're
we did inflammatory markers before, during, and after? What it oh, okay.
okay, anybody that's listening right now, okay, Terry and I, just a little funding, just a hair,
Yeah,
right?
yeah.
We can
Throw
both
us
what we
some
did
cash,
GoFundMe can
people,
do
so
too.
we can do this.
If
Yes.
there is anybody that is working with
Wild.
a research company that is doesn't have a bunch of skeletons in the closet that we're gonna go now I'm sorry, you guys gotta go. But just somebody, right? That because that's
Yes.
an idea. So as you're talking, I'm thinking everything I know as a this is so crazy. You have these like major kaboom moments, right? When you're
Yeah.
talking something through. Everything I know about EMDR, the whole basis of that intervention, all the research that goes into it, okay, doesn't tie that into it.
No,
Are
it
we missing
doesn't.
that piece? Are we
I
missing
think
that
we
piece?
are. I think we
Okay.
are.
All
We're
right.
gonna make our
Okay.
mark, Jen. I just feel it.
Okay.
But
We're gonna
I
make
wanna
that.
add one more piece into this. Okay, so someone like me who has toxic positivity, someone like me who, by the way, I did original research on happiness and positivity, so which I think is
I was
hilarious.
kinda
But
waiting for you to bring that shit up when we're talking because all these people that are out there that like, "Oh, Terry, what do you
But
know?
if I
You're
were to
not a blah, blah,
redo
blah."
it but if I
Yeah.
were to redo that research today, I would
Yeah.
include inflammatory markers. I really would. Anyway,
Yeah.
now that I know. But, someone like me who has struggled with autoimmune disorder, so hypothyroid is autoimmune disorder,
Mhm.
since my 30s, early 30s, okay?
Yep.
I automatically have higher, inflammatory load because of this autoimmune disorder. So
Yep.
I will always have that. right? Which I try my hardest to mitigate through certain things. However, so like flying, right? So I said this a few podcasts ago when I came back from vacation. I said, I'm swollen, I'm inflamed, I can feel it, all this stuff. And then literally 2 weeks later, I could tell that I was in a sluggish, more hypothyroid-ish funk. Okay, like I can tell
Okay.
those things for myself. So I knew that the more inflammatory load that I had would probably create this. Now, a couple of things that I was doing that created more inflammation outside from very long flights, which does that to me.
Sure.
But I also on vacation was eating gluten. Um, you know, I was taking enzymes to help, but I know that
Yeah,
doesn't really help.
it's almost
Yeah,
sacrilegious to go where you went and not eat the
I
food, like,
know,
you just
and the
you just said it,
bread,
yeah.
like, all
Oh.
that stuff. Anyway, so I was doing the things that I know would probably create inflammation. What I
Yeah.
didn't tie together until recently is that put me into that fatigue, that hypothyroidish space again, right? Which I'm
Yes.
now coming out of, but I know that that's a whole part of it. And then if you tie on to somebody, and thankfully, I mean, I used to be very negative, which is why I did my whole dissertation on happiness. But anyway, whole different podcast. Uh, if I were more on the negative side, like if I were more on the self-critical, self-deprecating, the world is horrible side of things,
Yeah.
it would have been a million times worse for me because then I would have created my own inflammation. I would have had that already on top of the inflammation that happened from
Oh,
travel.
sure, sure.
Yeah, so I'm like,
So,
it's so
okay.
in many respects, if you and this is hard, like if you struggle with autoimmune conditions or, you know, just infection or diseases, which by the way, stress promotes many of those disease states because of
Mhm.
inflammation.
Yeah.
If the one thing that you can have the most control over is your thoughts and that helps reduce inflammation,
Yes.
wouldn't you want to do that? You know, that's free. It's free. It doesn't cost anything.
Yeah.
It's free.
It's not and it's probably one of the more difficult interventions.
Yes. Even though it's free, but I say free because so many people, like when we talk about nutrition, well, that's expensive. That's
I can't
expensive.
afford that.
I
Yep.
can't
Mhm.
afford that.
Mhm.
It doesn't cost anything to think differently.
It does
It
not.
costs a lot to not. Like the
Yeah.
cost there, never mind my 1995 fax machine going off the background.
Is
Sorry
that what
about that.
that is?
Yeah, it's insurance
Oh,
companies because
yes.
they're the only ones that have my fax number, so it's some insurance company trying to get a hold of me right now.
They're the only ones that use fax machines. Like, let's just
Right.
be clear on this.
We're
What is
swirling.
Oh my god, we totally
But
are.
you know,
Okay.
I
So
think about the power of the thought, and then so, interestingly enough, because the question is, well, then how do I reduce my inflammation, period? Like, how do I reduce my inflammation?
yes, let's get to it.
So
To
I
it.
think, thoughts are one way. Right?
Mhm.
So thoughts, go to a therapist. If you can't go to a therapist, listen to self-help podcasts.
Oh
Let's
my
get a
gosh,
self-help
yes.
book, like all these things. Like go ahead and do those things for yourself and catch yourself, in the act, right?
Yes.
Of self-deprecation or whatever because ultimately people who do it know they do it.
They
They
do, and we're
do.
our worst enemies with it too. Like,
100%.
we are our worst enemies.
Mhm.
I catch myself even before we started here, I was like, I didn't do enough reading because Terry and we set like 9 articles in between each other, right? And I only like got through like 5 of them, and then I'm like, "Oh gosh," and I'm just like, "Okay, this isn't gonna be good." Like, and I literally sat in this chair and went, "Actually, I'm gonna make it through it just fine. I will be
It's
able to
going to
reference
be
things
fine.
like."
I'm okay.
Yeah, so
Right.
I caught myself, I'm like, I didn't do enough to even sit in front of this and to be able to speak eloquently, not only with you, but all of the people listening to offer something, right, good enough. And I'm thinking, "What the hell am I saying that for? Why am I what?" The world is not gonna end,
Right.
Jen, when you can't be eloquent.
Right.
Boom, and I felt better because it did.
Exactly,
Yeah,
or like
okay, right?
today, our audio and video is a little bit weird. The world is not gonna end. You guys are gonna power
Mhm.
through because you're gonna
Yeah.
love the episode. That's the way it's gonna be, right? Like, there's some
Oh.
things we just can't manage, you know? Yes, so I think about that and I'm like, so the first thing I tell people is like neutralize your thought first. Like if your self-deprecation thought is I'm a failure and I'm not good enough, we'll just use that. If I
Sure.
tell you to say I'm good enough, I'm great, I'm whatever in those moments, you will not believe it at all. Like
Nope.
so the neutralizing thought needs to be in the early stages something believable and that believable thing could be I'm okay right now or in this moment I'm good. Like or I can be good right now. Like something like that is
Yeah.
helpful to neutralize. But the first thing is that, conscious awareness that you're doing it and then stopping it and then
Mhm.
replacing it with something neutralizing. But
Yeah.
that's all like work with a therapist, and it's interesting because again, therapy is expensive. And I'm like, a lot of things are, but so is your health.
They are. Right.
If your thought patterns create inflammation and inflammation creates disease states.
And then the disease states create additional interventions for the disease state that makes the original problem worse in the first place. It's like that T-shirt that guy had that you took a picture of and put on Instagram with like, I took this and it caused this. I did this
Yes,
and it
this
caused
and
this.
the
I did
dis
this and it caused
yep,
this. But it really is right. Like the
yeah,
idea of if we can, let's get to the state of where this started. So if you
mhm,
spend a good chunk of your day telling yourself that you suck and that you can't do it, and if
yep,
we know that those connections in the brain have almost and I'm going to use the word bidirectional because one of those studies we looked at talked about this bidirectional
yes,
relationship between mood and inflammation and
mhm,
how it is, right? You're getting it from both sides.
yes,
You're getting it, it's coming from both ends, right? Like, so
and I'm gonna overgeneralize a minute. I feel like women self-deprecate more than men. It comes out differently. For
yeah.
men and again, this is stereotypical overgeneralization, I get that, but I'm like, men to me come out irritability, problem solving, knocking down ideas,
Yeah.
that side of things, like, which is
Yeah.
still very negative, and still
Mhm.
can cause inflammation. So,
Right.
men and women, if it doesn't resonate with you that you self-deprecate, it might resonate with you that you live on the negative side of life or you look for problems all the time. That might resonate
Mhm.
with you then.
Yes.
So, yes. So then let's do a little bit of physiology, right? So the thing is that we also know that what we put in our bodies is can be inflammatory, right? Alcohol, for instance, is inflammatory.
It is very
Smoking
inflammatory.
smoking is inflammatory.
Mhm.
Sugar is inflammatory. So if these things resonate with you, you just might want to consider the relationship that you have with that, right?
Right.
So also, you think about how your body functions. So how can you help your body, like I'm going to say detoxify, because your body, your liver is a huge
Mm.
filter. How
Mhm.
do you help that detoxify better to reduce the inflammation, right? So there's two
Mm.
parts, your digestive system and your liver, you
Good,
know?
because people ask us, I want you to go to gut even for a second, because
Mhm.
people ask us about that all the time. And people are gaslit into believing, especially, I mean, my goodness, all the time. Jen, I take a probiotic, I'm fine. Jen, I take a probiotic, I'm fine. Like I hear this all the time. Yeah, my gut
Mhm.
health's fine because I take my probiotic. And I'm like, do you okay, we got to talk just for a second about this because gut health it goes both ways. It's either so oversimplified that people just don't pay attention. They're like, yeah, I do this, it's fine. Or they go so far into believing that it regulates everything. Like when you have a
Right,
lot, because there's a ton of research out
right.
there that talks about that causal relationship between
Yes.
serotonin in the gut. Okay.
Yeah.
So, but you just said when you were talking about the gastro, we're talking about our lot, like go back to that for just a second because I think that's something people are curious about it, but they don't understand the gut's role too, and this gut biome and what that does when it comes to inflammation and mood.
So, your head is connected to the rest of your body. Your body is connected, your organs are connected to each other, right? So anything that you stick in your mouth is going to have a response, right?
Yeah.
Anything, because that's how not just your mouth, but your skin and things like that. Like
Yeah.
I'm going to go down the toxins route. People don't like this either, but our bodies are meant to detoxify. They really are. But are they meant to detoxify with the toxic load now that we have? Right. I mean, when babies
Okay.
are born with a toxic load, that's a problem. Right. Like when a
Correct.
newborn has a toxic load, that's a problem. Okay. So think about it in terms of that. So how do we support our body functioning basically from the brain down to how we detox through our sweat, through our excrement, through our urine. That's how we
Mhm.
detoxify. How do we support that? Well, the first thing is getting your absorption better. Okay. So again, if you take a probiotic, that's great. I'm never going to say don't do that. What I am going to say is, okay, but that will not change you drinking
Mhm.
alcohol. That will not change a highly processed food diet. You can't supplement your
Yes.
way out of
Yeah, a shit
yes, a
lifestyle.
shit lifestyle. You can't. But I
That may or may not have been one of my posts on
well,
Instagram. You can't out
you
supplement a
you
shit
can't.
lifestyle,
But I think we do
but
that
that
because most of those supplements are pills, right? So we are used to take this
yeah,
pill and that'll help you. And unfortunately, supplements have the same rap, if you will. Take this
they do.
supplement and you'll feel better.
They
And people are
do.
like, these supplements
Yes.
don't work. And I'm like, well, I mean, I don't think it works. Your diet doesn't work with the supplement.
Correct. So that's where you were going, so I'm gonna bring you back to
Mhm.
that original statement because I got you off a track a little bit here. The idea that the gut is not going to
Mhm.
absorb,
Yep.
right, all of these nutrients, whether it's from food, whether it's from supplements, wherever you're getting that nutrient from, as effectively if your gut biome is crap.
Right.
I mean, really,
Really,
truly.
truly,
Like,
which
and
then
I'm really
no,
simplifying this,
right,
but this
exactly,
is
because
where
'cause
you
we've
were
got only
going.
have a few minutes, but then
Yeah.
your liver then takes over, and your liver detoxifies, okay? So, when you
Yeah.
say when there's this whole diet culture out here for detoxing your body, there's really no way to detox your body except to support the organs that detox your body, right? You're supporting the organs. So, if you're gonna do a juice cleanse, that's not really gonna do anything for you, really. You're gonna feel like shit, and they're gonna say, "Oh, that's part of the cleansing it's not. Detoxing your body in the way that your body detoxifies normally shouldn't hurt, you
Mhm.
know? It shouldn't hurt.
Yeah, yeah,
Right.
good point.
So, your liver has basically 2 phases of detox, but it can only get there if you are absorbing the nutrients needed through your gut health, right? Through your gut health.
Yeah.
So the 2 phases, and I have I should share the screen. I'm gonna share the screen here, and, you
Oh,
guys need to go
good.
on,
Love it when you
YouTube to
screen
see the
share.
screen share, okay?
Yeah.
This is from my oh, I gotta turn it on. There we go. This is
There
from
you go.
my, biology class that because I'm getting a degree in biology right now because I'm
Yeah,
glutton for
because you need
punishment.
another degree. You are so glutton for punishment.
But I love this stuff, like, I
Oh,
just love it. Anyway, so you
no,
can
you
see the
don't.
2 phases of liver detoxification, there's phase 1 and phase 2. The only thing I want you
Yeah,
to really pay attention to is, the nutrients needed at the bottom. So, phase
yeah.
1, nutrients, vitamins B2, B3, B6, B12, folic acid, glutathione, and flavonoids. Flavonoids come from vegetables, okay?
Mm,
Same they're
mhm.
very similar, magnesium, cysteine. I don't even know how to say this word. I'm taking a biology degree, I don't know.
I don't know, I can't really see
Methionine,
the screen because 'cause I'm
whatever. I'm
old.
gonna say that totally wrong. I'm gonna get totally slammed for that. Glutathione, B5, B12, vitamin C, glycine, taurine, glutamine, folic acid, choline. A lot of these things,
'Kay.
Jen, I've taught
Mhm.
you, like, these things.
You have.
Um, so
All
if
these
you want
things.
to support your detoxification, which supports your inflammation, right? Reduces your
Mhm.
inflammation, you need these foods. Where do you get foods like this? 2 simple spots, 2 simple food choices. One is fiber. Okay. So increasing your fiber. There we go. Now we're back on. Increasing your fiber. And the other two is vegetables. And vegetables increase your
Veggies.
fiber too, right? So,
Yeah.
like simplistically, eat more vegetables, less crap, more vegetables. That will help with your inflammatory response. Also, when you clean up your diet, like we wonder, like, okay, you have genetic expression, you have bad detox genes. Let's just say you've got bad detox
Sure.
genes. How does a genetic SNP get turned on? Stress. What's the stress?
Correct.
Usually, I mean, it's an
Mhm.
external stress or what you put in your body stress, right? So
Mhm. Yeah.
we go back to it's all the same stuff. What foods help heal your gut? Prebiotics, probiotics, and whole foods, right? Like
Yes.
so it's all the same.
Yes.
What foods heal your brain? Whole foods, omega-3
Good
fatty acids. Omega-3
food.
fatty
Yeah.
acids are also anti-inflammatory. So I'm gonna
Yes,
go
they
back
are.
to if you have PTSD, the inflammation you're becoming more anti-inflammatory and more inflammatory. Oh my god, an omega-3 fatty acid might just be what's called for here, like
Yes.
so again, I can dive down this rabbit hole pretty damn far because it starts
Yeah,
somewhere and
you
goes
can.
goes someplace else, but if you want to support the health of your brain, you want to reduce your overall inflammation, two things. Thoughts, start with your head and start with your mouth.
Yep.
Oh, wait, your mouth is in
Yeah.
your head. So there you go. Just start with your head.
The head in
Head
the
in the
mouth
mouth hole.
hole. The hole in the mouth head.
Exactly.
Yeah, that's all there
Seems
is
so
to it. So
simple.
you
It seems it's not
it
as
does.
easy as we
Yeah.
think, and it's harder to do, but you got to start somewhere. People need to start
Mhm.
somewhere because I think we've also worked our way into this idea that there is no help, truly. We're always just gonna be managing our
Mhm.
symptoms of mental health, like, that's it, or learning how to cope
Mhm.
with the symptom like, or we can make it go away.
So you're what what I'm hearing you say, Dr.
Yes.
Terry, is that if I've got some mood issues that I'm
Yeah.
struggling with, one of the things that I could consider doing is really looking at my diet, looking at what I put in my mouth, and looking at how I think and actually starting to pay mind to these thoughts I
Yeah.
have. And if I start doing some of that and understanding that, I might have a chance that my depression or my anxiousness or my symptom, my evasive like
Yeah.
psychiatric symptoms that I've been told are psychiatric, they could actually maybe get better because there's a relationship between these things.
100%. And if you have an
Mm.
autoimmune condition, I mean, obviously, eating better foods helps, you know?
Yeah.
But like me, like I said, like, of course I'm gonna live my life and I'm gonna do things. I'm not gonna stop flying just because it inflames me, but what I'm gonna do
Yeah.
afterwards is take care of myself differently, right? And I'm always
Mhm.
gonna pay
Same.
attention to my thoughts, because it's easy.
Okay.
It's easy. When I get into the state of when I know that the autoimmune condition is kind of running my life, my husband now knows too, and he'll say something, and I'm like, "Yep, it is. I already know," because I'm a little more drawn down. I'm not as like energetic and handsy, right? All these things you can see. Um, so
Steve, I can see your
yeah,
husband.
she's not
She's
handsy,
not handsy
right?
right now.
She's not
She's not
handsy. I can
handsy. I
tell,
can
right?
tell it's really
Exactly.
affecting me. She is not handsy.
It is at that point I'm paying more attention to trying not to dive down the thought rabbit hole, you know what I mean? Like, so I'm
Yeah.
trying to keep all that in
Yeah.
check because it makes it easy when you're down in this fatigue place or it makes it very easy for those negative thoughts to come into play. So, if you gain control of those, then all you need to worry about, I say that easily, is the nutrition part,
Yeah.
So,
Right.
instead of both
Yeah.
things at the same simultaneously. But I don't know. I think the inflammation conversation if you want to think about anti-aging, it's anti-inflaming, you know? So
Exactly.
mhm, yeah,
Exactly. Yeah, and that's the tie-ins for all that stuff that we see out in media right now, really, for the anti-aging stuff and the anti-aging diet.
All
This is
inflammatory stuff.
exactly what it's tying
Yeah,
in.
we
Yeah.
just
So,
package it differently. Everybody
yeah.
packages these things differently, and when Jen and I talk, because we do brain health with our clients all the time, reach out to us if you're interested. You can reach out to us on the Gaslit Truth
Mhm.
Podcast at gmail.com if you want to work with either of us. But
Mhm.
now I just lost my whole train of thought. I forgot what I was gonna say.
Well, I don't know, but you're going right into, like, a nice little wrap up about something, like, you just got our
Oh my
email,
gosh.
which usually
Oh,
means we're
what I
getting
was
to the
saying is,
end. She didn't take her
I did
omega-3s today.
actually. I did.
Oh!
No, what I was saying is different people wrap it up in different ways, and Jen and our focus is not on the wrapper of weight loss, it's on the wrapper
Yeah.
of mental health and brain health, right? So when you see influencers talking about all this stuff, they're really talking about it for weight loss. It's a lot of the same
Yeah,
stuff. It's a lot of the same
it is.
things, if it's
Yeah.
somebody decent that you're listening to, but it's a lot of the same information, with
Mhm.
just a different
Yeah.
emphasis, right? And I'll tell you what, it's a lot easier to sell, especially middle-aged women on weight loss than it is brain health, which is really bizarre to me. Um,
It
yeah, so one
is.
of these episodes, we'll have to talk about that too. Mhm.
Yeah. Alright, well, that seems like a fair spot
Wrap
to
it
wrap up here
up.
because I'll
Okay,
take
woo.
it, wrap it up. I feel like you're forgetting what
I
you're
know, right?
saying. I'm just listening to you and intrigued by because, like, here you guys really we're wrapping this up, but while Terry is talking, there's, like, at least a third of the stuff she said today that I'm like, "Oh, yeah, I gotta incorporate that
Right.
with my clients. That's right, I
Yes.
forgot about that." Yeah, like, so she's, like, educating me here too, which is kind of fun because I
Toxic positivity. Yes.
oh my
You
god, you
gotta
guys
watch
gotta
us on
watch this on
YouTube.
YouTube. I do the stupidest shit. Okay. Anyways, but this is a great spot to wrap up. So we are the Gaslit Truth Podcast. So like Terry said, if you would like to shoot us an email from, I mean, if you want to work with us as a client, right? Brain health clients, we
Mhm.
are the Gaslit Truth Podcast at gmail.com. Also, we are on all the socials, right? You can hit us out on Insta. We are on Facebook, anywhere as well that you are going to get your podcast, which I know we have a ton of Spotify listeners. That is where a ton of, like, so
Yes.
much feedback is coming lately
Send us your
from,
pictures of where you are listening to the
yes,
Gaslit Truth.
where
I
do you
love this that
listen?
people are sending us these pictures, and it's so fun.
Yeah,
I love
I
it.
know,
Yep.
but DM us your stories to tell us what you think. Do us a favor and let us know your thoughts. So many people will reach out, like, personally that know me, that watch us, and they'll text me and be like, "Oh, this is so cool. You guys are doing blah blah blah." And I'm
Mhm.
like, put it out there. Like, put it out there for everybody to see because it's neat for people to see that there's it's just it's making a change
Love
because
it.
that's the whole point is we want people thinking differently. I feel like a Sarah McLachlan song should play right now
But it
for
won't because we're
us
gonna head out.
because I know. Oh my god, because we're gonna head
Thanks for
out.
hanging
So,
with us.
but go ahead and rate us. Thank you guys. You have a fabulous day. And remember the relationship between the brain and the gut. It's
That's right.
bidirectional. Hi. All right. Thanks,
Peace out.
everybody.